Good afternoon, everybody. Today, under the auspices of Manukotari Chair and Division of Medical Humanities, it is my proud privilege to be interviewing Professor Avinash Supe. It's indeed an humbling moment because Dr. Supe has been my teacher, my mentor, my guide, and my immediate boss for many years. So we set the ball rolling, and especially for the people who do not know much about Dr. Avinash Supe, I would like to begin by asking Sir that if I were to ask you to introduce yourself, how would you introduce, especially for the new medical entrants and a lot of residents who are not from Mumbai joining us, how would you like to introduce yourself?
Sure. I think I would like to introduce myself as an GSite who entered this great campus in 1974 and as a student and then retired as a director of these institutions over the last 40 years. And the spirit of whole KEM has imbibed in me, and that's what I feel I would like to really introduce myself as a GSite.
So, sir has been very modest. So, let me put it. Sir was professor of surgery. Then he went on to become professor and head of GI surgery. And he is being revered like a god in this temple of medicine, that is GS Medical College and KM Hospital. To be very honest, as we were walking down for this interview, there were literally two people falling on his feet and saying that the god of KM has arrived. So that's it. He has been very humble in his introduction. So, Dr. Supe, you have donned many hats, that of a clinician, an academician, a teacher's teacher, an avid hiker, an ace photographer, an able administrator, and now a prolific writer. So, with whom do you identify the most?
I think I still, as a clinical teacher and clinician, that is what I would like to still remain to be remembered as. Of course, I was an administrator and photographer and hiker, but I still feel I am remembered should be as a clinician and clinical teacher because my life has always whirled around that.
So, once a clinician, always a clinician. A clinician in you never dies.
Yes.
And you are using that experience in the other fields, extending it to the other fields.
Yes.
Should we say that?
Yes, definitely.
Sir, generally people give your example that if you have to plan your career, you should look at how Dr. Supe has planned his career. So, did you really plan it, or it just happened and went on happening and it fell in its place?
I would say it is partly done that way on both fronts. It's not fully planned, but I realized it that as a clinician, when I started as a clinician, then that time I realized that there are various aspects I must tell you this is. When I started as a clinician, I realized that we have to go at a higher levels of clinician. It's not that we are only going to do just hernia hydrocele and basically you need to go into complex surgeries. For that, you need to go into super specialties. So we worked for that. That was one side of it. But the other side is when I realized that this is one potential where we can really make teaching, administration. Somewhere when I was in 40s or that time, I started training myself. And I went to universities, I went to data institution, and I continued to build my skills in that area. And then I said I will plan it, and then at appropriate moments I made interventions into teaching and administration. So I think it was partly planned. I'm not saying it was planned at the beginning. Similarly, whenever I did various kinds of hobbies, I saw to it that I do right things at right time. For example, when I was doing hiking or something like that and trekking, I did it somewhere when I was young, when I had energy, I could climb mountains very well. When I realized that now I have reached to 40, 45, I shifted to wildlife photography, nature photography, which was again adventurous. Now I go on to say jeep photography or travel photography with some kind of a tools like that. So I personally feel you can really plan adventures in that particular age related kind of a thing. So that was definitely planned. In same way, teaching careers, somewhere opportunities, somewhere I utilize very well, somewhere planned kind of a growth.
So basically, your mantra for success is that you keep on upgrading yourself from good to better to the best and to do right things at the right time.
Sure.
That's what you want to say. For some people who do not know, Dr. Supe was also the director of Asia Pacific FAMER, that is Foundation for Advancement in Medical Education and Research. So he has been teaching the teachers of how to teach. So that is what Dr. Supe is, which I think he did not say in his introduction. Sir, it is said that behind every successful man is a woman. So can you tell me what role did your wife play in your success?
I think it's a very interesting question, and I feel my wife has contributed immensely into my career. And we both of were, I know Madam Lopa, Madam student, and we have a GSites. We have a typical GSites who have married on a katta prem, you know what we used to call. And that is the way we have married and we have grown together. We had no background of medical in our field, our houses. So when it came to something like post-graduation, my wife and me, we had decided, yes, one of us need to go into private and one of us need to go into academics, because that's the balance everybody has to believe in. Because if you want a growth, you need to spend your energy and time into these academic institutions. And if you want to have your house stable, at least, I'm not saying on a lot of money, but at least you have a comfortable, and because that time full-timers pay was very less. And therefore we decided that, okay, let's balance this out. And Swati was very much interested in general practice. So I think she decided to go to general practice. And because she held one side fort of my home very well, of my family and my daughter and house and everything, that's the reason I could spend a lot of time here. And then I had no worries. And then I could develop myself the way I want to develop. So my wife has immensely contributed. I think ultimately that matters most, because that doesn't mean my wife has compromised her career. She has her own kind of a canvas. She is music. She has done what you say music. She has finished her BA kind of a music, and then she has also now become a Brahma Vidya teacher, and she conducts lectures. She has a whole international and national students, and she has her own kind of a portfolio which she has worked along with her general practice.
So she also has grown in her own way, in her own field, what she
Absolutely.
liked.
She had liked and she has grown in that field. She also writes and everything. So I personally feel it's helping each other and understanding each other, and I think that is very important, especially when you are growing.
So it was a classical example of teamwork where both of you complemented each other
Yes.
towards this successful life which you are leading.
Definitely.
So that's very important, right? Because nowadays we see both of them pursuing after career, and I think that takes a toll, some toll on the family life. Okay, sir. Sir, you said at the onset in your introduction that you have been a true GSite, what we call as blue-blooded GSite, having done his UG, PG, faculty, everything in KM. So any personalities or any teachers which left a mark on you, an impression on you, whom you imbibed and thought of taking up as a full-time career?
Definitely. I think if you have seen even my book also, I have written about my many teachers, but few of the teachers who really have imbibed me, and I have really talked about Dr. Samsi, Dr. Bapat, and Dr. Kothari, and Dr. Lopa Mehta, Dr. Dahanukar, and people like Dr. Bhalerao, Dr. C.V. Patel, all these people who are full-timers. And at that time, we were lured by them, to be very frank. When I was a student of Dr. Samsi, I thought, and Dr. Bapat, I definitely thought that I would be like to them and I would like to be a full-timer. In fact, I must realize when I was doing my MS, after doing my MS, I got twice admission to MCH plastic surgery. And that time Dr. Goleria and Dr. Tambekar used to come and tell me, no, Avinash, you must take in our department. But that time, all our full-timers that time, including Dr. Samsi, Dr. Bapat, Dr. Mathur, they convinced me that yes, this is a new field of GI surgery and you should develop it. And the advantage of that was, that time we wanted to remain in the KEM. We never wanted to go out of KEM. And because if I had taken plastic surgery, I would have become MCH, but then there was no position for me at that time, and I had to go into private practice. So because I was already a lecturer and I wanted to pursue my career, I thought remaining KEM is more important for me, my growth. And that's the reason I continued as GS site. And I think that has definitely, and it's not only my teachers, the way they lived, their work-life balance, their interests, their academics, I think all that has influenced us, especially when you became continued as GS site.
So for the viewers and listeners, the names Supe sir mentioned, that is Dr. Papat, Dr. Samsi, Dr. Bhalirao, Dr. Dhanukar, Dr. Manu Kotari, they were all doyens who really were gems of KM, and we indeed miss them today. Sir, you said that you wanted to become full-timer out of choice, and that's why you left, even did not think of taking up MCH plastic surgery, because you thought you would have to leave if you took that. Were you ever lured in taking up private practice during your tenure?
As a full-timer, I worked for almost about more than 25 years. And then I think there was opportunity where I could continue and do little private practice. So I was doing private practice, limited private practice in Chembur next to my house. But after doing our regular 9 to 4 job, in the evening for 6 to 8, we used to do a 2 hours practice. And I think that to give a feel about what a private practice, because many times I realized that the kind of patients which we see and the kind of demands we see are different in different sectors. And we should know about these sectors. And I think that time after working, I understand the money was still not very great, because it was just an help, because when you're doing only 2 hours practice, and that also OPD practice with few operations, you earn a little, but it is more often getting exposed to that sector, new techniques, new places. So that was the reason I think that experience was very helpful. And I explored that, and that was the reason where we could then get access to various other areas.
So just some time back you confessed that you would like to be remembered as a clinician, and you are a true clinician at heart. You had good 7 to 8 years to retire when suddenly you took up dean's post. Any particular reason leaving clinical side and going to a completely administrative side?
Yeah, sure. That's a good question, because when you realize you worked for almost about 35 years in an institution, more than 35 years, or maybe, if you are as a clinician, you're always helping one person, one patient. But as a clinician, you understand the hospital's clinical and patient needs much more. So you can do many things which an otherwise person doesn't understand. And I think during my whole dean's post, I tried to develop a lot of new specialities, new services, and which I thought I could have not done if I was only HOD GI surgery. And see, for example, like if you look back, the kind of services which I was there, I could develop. Like look at the neuro-intensive interventional radiology centers which I opened in all the 4 hospitals. And these were contributions which was not happening for so many days. Now we have isolated laboratories. And practically in every field, if you see, I could make a change and build up new centers. And see that what happens, when you are an HOD and you try to go and you know how we develop the transplant unit, we have to struggle so much. Now, if a clinician is heading an institution, who is a core clinician, then he understands the progress and update. Medical field is rapidly changing. There is a need for technology. And if you don't get that technology, institutions like ours will become absolutely average institutions.
But then do you think that this sacrifice of being a clinician was worth this?
I feel definitely worth, because now looking back, I have gone back to the clinical field now. I operate alternate day. I have been working, but at the same time, looking back those 8 or 10 years of my administrative thing, I think we have been able to contribute enough. If you go today in each hospital, in every peripheral hospital, every medical college of municipality, I feel I have started so many new things. Oncology wards, oncology units, then spatial urology theaters, if you really see. Now I developed 5 hospitals in Mumbai, which are of the state-of-the-art hospitals, which are already started building. Bhagwati, Shatabdi, then MT Agrawal. Now recently they inaugurated Cooper's Medical College, trauma hospitals. All these hospitals, when you start planning and developing, as a clinician, you can contribute immensely. Because I feel the choice you make of equipment, of the specialities, the services, you can understand it much better. And all your 35 years of wisdom, if you are not able to put it to that practice, is rather than somebody coming or some administrator or some politician coming and telling you that you do this. This is, I think here we understand as a clinician, we understand the society's needs, we need patients' need. I think that can make a much better decision. So somebody needs to do this sacrifice.
So basically,
And if you don't do this sacrifice, the community suffers. So I feel it's worth it. I mean, if you give your 5 years or 7 years career, there is nothing wrong in giving that career. I'm sure I could have treated about, say, 200 or 400 patients more during these few years. But now I've made services where thousands and thousands of patients will get benefit. So I think look at a larger benefit, you should always look at that.
so basically it's like giving back to your alma mater what it has given you for all these years.
And I personally feel that's a feeling when you go there and you find out, okay, this is what we have created, this is what we have, service we have created. I think it's like what I got through my institutions, I have given back to them.
Sir, during your tenure as a dean and director, did you have any moments of regret? Oh, why did I become dean? I should have remained a clinician. I was happy doing that.
Yes, occasionally. Definitely you go through all this kind of pains, and I think this happens in everybody's life, that when you take a bigger post like this, there are things which happen once in a while. You feel, oh, why did I go through? Especially in the initial days of your career, when everybody is trying to pounce on you and you have too much of demands. But over a period of time, you see, it's like as you start jumping into these spaces, initially you are a little less skilled. But as you get skills of networking, managing people, getting things done, and then you always feel, yes, now I am not feeling the stress. So there are moments, of course, where you feel, yes, I was happy. See, it's like I was very happy as an associate professor also. When I became a unit head, I had more challenges that sometimes I felt, why I did become unit head? I was happy as associate professor. You have to more, but once you become associate professor, then once you become as a HOD, you have more headaches. When you become a dean, you have more headaches. And when you become a director, you have to take the whole Mumbai there. So as you grow, your headaches and demands of people grow. But I personally feel, if you say every time that because I can assure you many of my friends who were my colleagues from the school, they retired as bank clerks or bank cashiers. They felt very happy with that. Now, there could be one person who wants to become from a bank clerk to that deputy manager or bank, all that, and one person who would like to retire as a banker. There are people's mentality like this. There are so many people who avoid promotions in our own systems. So I personally feel we should be ready to take challenges. And ultimately, it's a individual growth versus the institutional commitment. So if the institution needs a dean or director who has a clinical vision, I think we must really give that.
So based on your experience, can you say with certainty and assertiveness that a clinician does not become a good dean? This is a myth?
Of course, there's a myth. Look at all around how many clinicians and super specialists have become good deans. And look at now the demand of also now our dean currently is also neurologist. Then if you really see previously interventional radiologist was a dean. Then there was Dr. Monkar who was a neonatologist. Then Dr. Joshi is a surgeon. Dr. Oak was a pediatric surgeon. So I personally feel if you look at even the all over India, AIMS director is Dr. Guleria is a pulmonologist. Dr. Yogesh Chawla was a hepatologist. So who said it is not there? Dr. Rajesh Saxena
So is
is
it,
to take
so in short, it's not...
He's a transplant surgeon. So if you really see all over the world, if you see, there are so many. I can talk about MSKCC. One of my colleague was an ophthalmologist who became dean and director of the UIC. So clinical career, you should not really say, yes, there are people who say, I'm going to be clinician. But then at the age of 75 or 80, you are doing all one surgeries on your own, not allowing others to do, and making money. What is there in the life after some time? You think, are you going to be there for only earning life and earning money? I think there is much more to the life. There is much more contribution to the society, giving back to the society, how much of legacy you have created, how many students you have really made. Don't you think all these things matter to you after looking back? What does bank balance happen after a few years? Nothing. Money remains as a little value in our careers because there's a concept of unspent money. Your money, what you are spending today, you are not earning for yourself, you are earning for your children. And how much of money you are going to spend for yourself. So I personally feel you should, at this particular stage, you should look beyond. You should look beyond. It's not a question of, what will I do? I'll go probably in a first class instead of whatever it is. What is there in that? It doesn't matter to me at this particular stage. After some years or so many of years, I have gone in an economic class. I'm happy with economic class or a business class.
Sir is trying to say is that clinicians can become a good dean, director and an administrator. Sir, though you did mention, can you tell us briefly what you think are your biggest achievements as dean and directors?
See, as a dean, two things usually you should really understand. One is bringing little harmony in various departments and institutions. And secondly, have a good collaboration with the seniors. Now, if you are able to achieve this, your institution progress happens. So I could achieve that. I had wonderful relationship and trust of all the commissioners and additional commissioners. And I could develop a lot of harmony between the institutional departments. Now that helped in two or three things. Lot of academics started in many institutions. Lot of new services and procedures we started. To give you a simple example, it's not about so many, I can assure you, not only the question of the patient related services, which includes I'm not talking about the various services like say CT scan and MRI and all. This is okay, this is equipment. I'm sure I did a huge amount of exercise to get a huge amount of infrastructural development for the whole corporation. And to be very frank, if you look back in last 10 years, the maximum infrastructural development was installed during my period. That 5-7 years or 6 years or something. So that was one aspect. But more than that, what I feel, we got a lot of other things for the patient things, patient services. I understand, these are ups and downs, but now so many things which we got across.
Apart from this, you said that you started many divisions like oncology. Then you laid the foundation for the Hriday Samrat Bala Saheb Thackeray Medical College, Cooper and Jogeshwari started in your tenure.
I started.
Trauma hospital.
Then the
other peripheral pediatric setup at Borivali you had.
Where we started bone marrow transplant.
Which has come up in a big way.
They are doing they finished now more than 200 bone marrow transplants. And the kind of work these new specialties are doing.
And you did a lot of student-centric work as well. Helped to start a gymnasium.
Oh, that we do it very often. That though I don't count only.
Sir,
such things though we don't count only. How many things we do, small things.
What are your thoughts with regards to the medical education in general, the current scenario?
See, currently what has happened, a lot of things have changed because of the need and students' approach. And I personally feel we are going through a phase where both teachers and students have to change. What has happened, students are working for marks. They are attending classes. They don't want to concentrate on the clinical experiences or wards, and many of them are west faced, and the whole scenario is different. But and we are missing into the professionalism, humanities, value based, and all this. The whole idea of starting this humanity cell, the opportunity came when Madam came the idea. But I thought we need to strengthen the medical professionalism in our whole education. So it's like very clearly said, I was with NMC last week, and one of the presidents said very nicely that our education was knowledge, skills, and attitude. Now it has changed to attitude, skills, and knowledge. I think the single word you tell me that way, with the knowledge expanding in such a big way, people should not now, teacher should not be a knowledge giver. He should change his attitude and make yourself to be a person who is giving a direction, person who is facilitator, person who is changing the attitudes and role models of students. So the whole concept is that students have to realize that what we spend here in these organizations is a lifelong learning, and only going to particular class is going to a very short term gain. You will not become a good human being. And the second aspect is teachers should realize that we should forget about teaching with the same PowerPoint for 10 years. It's time that we should change. We should now see many times people create one PowerPoint and then they go on teaching it for 10 years with the same PowerPoint. Now it's time we should forget about it.
So you rightly said that the whole curriculum now is marks based. Means 12th standard students, they are preparing for NEET, they don't prepare 12th standard study well. Then when they are into medical college, from the first year onwards, they are preparing for their PG NEET. In fact, there are coaching classes which have started for this. So what is the remedial measure for this? You are at the seat where you can influence the policymakers. So what is the remedy for this?
Sure. So I think Kothari sir used to say they are all become zombies. They have become all zombies to the classes. I think these words have remained in our mind for so much. And I can see that if people are looking through that from morning to evening, they will bunk these classes, go there, start teaching MCQs, and those all junk MCQs, basically, which have no value. And then what kind of you are developing, and they create into a hypo-skilled doctor who is not able to see a patient, not able to even treat the patient. And this has been a big concern, and we have been raising this concern across the world. So what is the solution for this? The solution for this is at two levels. One, students always learn what is assessed. So we need to make a change into the assessment plans. That means we need to bring in clinically based assessments, formative assessments, internal assessments more and more, and give its value to the final assessment. So students will spend time in the ward. It's not only end one exam which will decide his career. The time has come to change to that. And secondly, the teachers have to change the way they teach and attract students to their classes. Today also, if there's a good teacher and he's taking a good clinic, students will still flout around. It's many times teachers don't have time in our system because they are busy with private practice, they are busy with their own agendas, research. So where is the time? See, first year, second year, and third year do very well. Those teachers are committed. But when it goes to the clinical side, I find there is a lot of things to be done about this. Many clinicians do not have time for teachers. I think that rounds taken with the teachers, the way the people move around, and the way they influence students, like we were influenced as a teacher to do a research or trial or any kind of a contribution to the society. I remember Dr. D.N. Pai at that time used to take us in a jeep to various villages as a thing. So it's a huge thing. You have to really understand the influence. The teachers can influence your students in very different ways. They can give the complete direction to you, approach to you. Your values are decided by them. Now, the whole concept is that yes, I want to pass this NEET, I want to get a PG, I want to do super PG, I want to go to any big hospital or I want to go to US. Is that my approach? If it's going to be my approach, then I cannot save you. But then what happens to them after at the age of 40, 35, they feel frustrated. I can assure you so many surgeons when they at the age of 45 trust come to you and talk to you frustrated. So we both paisa kama liya. Now we want to teach. Now we want to go to do some community. Now they should not face this kind of a music. For people like us, fortunately, see it is very interesting to say how do you balance work-life balance, and secondly, how do you achieve your career at a particular peak when you are at that time. It's very important. When do you reach to your tipping point? Or this is very important. For example, there was an sports like a Nadia Comaneci. At the age of 16 years, she got 4 gold medals in Olympics. After that, what? Now, do you hear her name? You have not heard her name in any. Somebody Philip got some 8 thing. Okay, somewhere in the Guinness's book, there's a record is there. After that, there's nothing. See, records are okay, but for living a life, the person should have that gradual achievement of various things, whether it's a finances, whether it's academic career, whether it's work-life balance, your hobbies, should go parallelly, slowly, till the time you reach somewhere around 55, 60, you reach to the pinnacle. Tomorrow you get, say, anything at a young age. Yes, you get it. Maybe you're a young achiever. At some ages, I also achieved young. But I thought many things you should continue to achieve skills till you get. Then the enthusiasm, happiness, satisfaction, joy, that will remain in your life. Otherwise, you will go into frustration. So it's how do you plan your life and how it balances is very important in life. Rather than trying to go into early achievers and see today what happens. Everybody wants 5 BHK flat on the 21st floor with Mercedes car on at the age of 35. Many achieve it also. With current, I think there are many, my colleague, I've seen them at the age of 40, they all achieve. Let me ask you, in spite of doing that, do they feel happy? They are worried about whether my patient will come to the next day to me. Will a competitor come to me? They don't find at the age of 60, they don't find anybody following them. They don't have students, they don't have publications. You have to compromise one aspect of life to the other part.
So basically today's students have become like a robot. They know everything about medicine. You ask them which MCQ, they will answer it. But somewhere you find that they lack the communication skills, the empathy towards the patient. Having said so, what I feel that the students are not to be blamed. They imbibe what they see. So do you think the faculties are at fault because they are not able to transmit those attitude towards their students? And do you feel that there are dearth of such good faculties like you and I had, whom we looked upon and whom we could idolize and become like them? Do you think that is the problem?
I won't say there's a dearth. There are intelligent and nice people.
There are, but you can count it on fingers. But they don't have time
for students. And they don't give the holistic view which a teacher has to give to the students. See, I think the greatness of Dr. Kothari was that every time he used to meet, he used to teach us another facet of life. And he never used to teach, he used to show it and do it. And I think you talk to anybody for half an hour or something, they influence you so much that it takes you lifelong. It tells you, yes, this is something which I should really look at it. So a teacher has a definitely role of influencing student, no doubt about that. I think today we need to I'm not saying our students are robots. No, they are very intelligent. They are more focused. I would use the word they are more focused. And they have their careers looked at from that materialistic world. See, fortunately for us, when we were students, there was nothing available in India. Now it is all available. That time international travel was not there. All goods were smuggled which were not available to a common man. Even to get a cassette was such a big thing at the time when we were students. So Now, because students, everything is available to them from tab at the age of say 6 months, and I think today I was read very nicely that what are the new milestones for a child. At the 6 months, he starts staring at a TV. At 1 year, she starts changing the channels. At about 2 years, she's starting seeing the tab. She has her own. So I think the new milestones of a child have changed.
So when I said robo means they are, as you said, that they are more focused. They have their things charted out. When a student enters medicine, he says that at the end of this year, 5 years, I have to get into cardiology. At the end of this, I will go for a fellowship. At the end of this, I will be practicing in US. That is how it is. So they are focused towards it. So they are looking at the destination. They don't enjoy their journey. That is what I meant.
No, see, I personally feel it's okay. Now, day before I had one student who said he wants to specialize in neurosurgery and stereotactic surgery. And he was in first MBBS.
Yeah.
So they have a clarity of their vision. I'm very happy about it. But they still should, because see, they should think about only one thing, that health is not only medicine and giving treatment. Health is a very wider subject. Health has social sciences, health has anthropology, health has history, health has every aspect of life which people should really look at it. Then only you will become a good clinician.
Somewhere the holistic approach is lost.
Is missing, according to me, and this is what a function of their parents, teachers, faculty, people around you. The way they should read about it, different aspects of life they should read, experiences they should get about it. If they don't get these experiences, and what happens in that, because of this whole focused approach, they sometimes miss the outer look of the whole life. And if you don't get that, probably then you see, I may be the expert technician, but tomorrow, let me ask you a very simple question. You are all talking about becoming technically expert. In next 10 years, we will have artificial intelligence and robots. At that time, today we have star has come. You know what is star? Star is one which will take perfect sutures for me. I have to just put that machine, anastomosis will happen for me. Now, if I am going to spend my whole life in only technically making myself superior, tomorrow artificial intelligence is going to, and technology is going to take my job. Then I need to have a big approach about, if a patient comes to me, I have to understand his social condition, economics, what is her background. If a patient of Adivasi comes to me, I have to look at what is her, I should go back. Now, if I don't understand this, I don't understand life, how I'm going to be a good clinician.
So that is what the students need to be taught by their
because
faculties.
there is no MCQ for this.
Yeah, by their faculties.
My worry is there is no MCQ for this.
That when you take a clinical decision, it is based not only on these, but so many other
Chetan.
social factors.
Exactly, Chetan. That's one of the things, a holistic decision. And unless you make your student think that way, make his thinking wide, broaden it, that doesn't mean I'm saying you should be technically weak. You and me have struggled so much, and we have, upgraded ourselves, and we continue to upgrade every day for our technology. And I'm sure, to be very frank, Chetan was the main, and we took our department from doing a gastrectomy to liver transplant. Now I feel this is technological upgrade which we made is it was hardly in 6 years or 7 years we made it. So the whole idea is not doing a transplant but taking your department to a level where the skills are so high. But that doesn't mean we should ignore the other aspects of life. Other aspects of life are so important for health because doctor, when you become a clinician, it's not a technologist. We should not be technologists only. We have to look the life much wider. And unless we create a doctor like this, we have not done our job properly. That's what I feel.
Absolutely. Sir, it's generally seen that nowadays many medicos, they dissuade their children from taking up medicine as profession. What do you think is the reason?
I personally feel they are worried about medical legal cases, economics. There is so much of other things have come. Whenever you want to grow, there is so many other factors are coming. The life is, they feel always on the other side that the life is good with the bankers and financial experts who work from 9 to 5 and in the evening you go in a pool and drink. I think that's the way people look at it. And that's the reason many of the doctors' sons and daughters go to all this field. It's okay. I mean, that's a way of looking at it. You have looked the life in that way. But your son is a surgeon, and my daughter is a gynecologist. So it's not that it's true everywhere. And I think the way you look at it, yes, I mean, they have taken their own decision, and I'm sure we have not influenced, unless it may be indirect influence. So I think it's the way you look at it, the way you want to live. And I will tell you another thing. See how the life changes. When I was a student, postgraduate, surgery was the first choice. After 20 years or 30 years, radiology became the first choice. Dermatology became the first choice. But in next 20 years, it will change again. Why? Because radiology and dermatology will go to the artificial intelligence. So again, the radiologist will have a limited role. Then people will go to the interventional radiology. People will go to the neurointerventional radiologists, because ultimately, unless there is a human and technical component into this, that technology where the people would like to go, because that is where it will be elevated. So we need to think about when somebody takes a career, we have to see. And the second point I must tell you, look at most of the computer programmers or bankers. What happens to them after age of 45? Don't you think all of them come in our OPD? If you see in any private hospital's OPD, all these people will come, and all of them have IBS, NUDs, they have all kinds of psychosocial disorders. They are stable, unstable in their minds, and they have so many. I'm not talking about family life, that is a different concern. But you pay a huge price for that in spite. So what matters? The fiduciary duty of a surgeon is one aspect, or a physician is one aspect, but joy and satisfaction, these are the two important aspects. When you are doing, you should not only get joy, but you also get satisfaction. And if you don't get that satisfaction, the medical field is one field, and clinical field, when you see your patient who has come to you in a very bad state and he starts walking, I think going back, that satisfaction and pleasure cannot be replaced with tons of money. Absolutely. And I'm sure you have experienced it. I experienced it every day. Last week, I must tell you, we had such a patient with massive tuberculosis, and she was a home worker. We operate, next week she walks home. We feel one of the happiest thing in our life that we have helped her. Their money is not a big issue at all. Whether you may not charge her.
The smile on the patient's face
and walking home back
makes it up for everything.
And I think that ultimately the way you look at your life, I think that's very important in life.
Sir, what is your opinion about the current practice where the full-timers are allowed private practice? Do you think it has affected the teaching and the patient care? I want your perspective both as a clinician, because you have done this, and as an administrator where you had to discipline them.
Yes, so what is your opinion? It has definitely affected, no doubt about that. I personally feel in our place, there are some people are very sincere, and there are some I can call them cutting corners, and some are cheaters. I would divide them into three categories. There are people who would come here and do 9 to 4 and plus do private practice. I'm okay with them. You cut minor corners, I'm okay with that. And I personally feel if somebody is coming 10 minutes late or going somewhere, but he's still taking keen interest here, teaching, doing the duty here, I'm okay with that. What may I worry about is people coming at 7 o'clock and then working into some private hospital and coming in the night and 10 and doing that punching. It's a pain. I tried to correct few people, I removed few people, I think all my people were after that. But in our system, what happens? People are smarter, and you cannot look at that in a very difficult way. People are not there. So it's a self-conscious. I think all of us should remember that yes, we are here, we have taken this major job. I get a fairly good amount of money from this hospital as a professor and head. I should see to it that I am cautious about it. Just your conscience is working, most of you will do well. But there is an effect. It affects your teaching, it affects your clinical work, and then you try to take decisions, sometimes compromise decisions. which is not good. So if such people are doing, the system should throw them out. I tried to do, to some extent I was successful, some extent I was unsuccessful. But I feel, I'm sure this is a situation everywhere, but as I feel the number of doctors are increasing and the number of people will be available, the things will change in 5 years. And then if you have more people available in every specialty, I think administration will be able to take a very strict decision, because whenever it used to come, okay, I remove him, then what do I do with that department? That department will get de-recognized. And then there will be nobody to department look. That means the service will be stopped. Then the point is, can I compromise and do service? But then at the cost of the service, all these points, we sometimes may have to allow people doing all this. But those who are whole-scale cheaters definitely have to go out. I'm sure there are 20-30% people who need to go out of these hospitals. And if the opportunity comes and people are available to us, as more and more, as you know, we are now having almost 1 lakh students. And in next 5 years, whole medical field is going to get flooded. The specialists are going to fill it. I can assure you, all these people who have enjoyed all these kinds of cheating, in next 5 years, they will have to stop. Because the administration then will be in a position to take a decision and throw these people out who are cheating. It doesn't mean that administration does not know. They know everything. Everybody knows who is going early. Sometimes I have called people personally and told them and giving them. Some of them I have removed also. Some of them I have done inquiries also. But then the question is, if you spend your whole energy into that, where will you look for the positive growth?
So do you think then is public-private partnership an answer to this, where the private will run the whole show in a very corporate manner and have a strict control over the people?
It's an experiment at this stage. It's not fully worked well. I am on the PPP model committee for the government of Maharashtra, and we have been advisors to the everybody. So the whole concept here is, yes, you can run it that way, but there are a lot of cross-cutting it's done. You know, I understand you get a service at a little cheaper, government doesn't have to spend, but then there is sometimes there is a quality loss. You know, but we need to monitor it well. So it's a good model, but we need to monitor it well. And as you know, ultimately it's over a period of time, see, the systems in India will require a lot of refinement because of the politicians interfere. There is a lot of money being involved in all these systems. We need to monitor it well. So PPP model is a model as a good, but when is somebody is implementing, it has to be monitored.
Do you see it happening in near future?
It is already, they have ordered, but investors have not yet come. So if the investors come, they are going to open hospitals at Amravati, Latur and other places.
Sir, with the present situation of stagnation as far as promotion is concerned, the present salary structure compared to what people earn outside, many of them are discouraged to take up full-time practice. So are you worried with this trend?
I don't think so. There's a cycle of 10 years. I personally feel. Every time there's a cycle of 10 years.
Or do you think that good people will not stay back?
I'll tell you, there's a cycle of 10 years. I must tell you what it is. See, when every time a pay commission comes, your salary is slightly matched to the private. As the pay commission goes, there's a gap really starts coming. You know, this has happened for every 10 years. 4th pay commission, 5th pay commission, 6th pay commission, 7th pay commission, and 8th pay commission. Every time when the pay commission comes, the full-timers professor's salary is equivalent, slightly close to what people earn in private practice, little less than that. Over 10 years, the gap increases, because then that fellow starts increasing double and you increasing less. Now the question is, if husband, wife are staying and they are working, you have a good quality of life, or one is in practice, one is in full-time, and you understand that these are my priorities, academics is my priority, teaching is priority, I'm going to have this my thing, then I think the life is much bigger than what you achieve. And the people don't realize the potential of these public institutions. That you realize when you start going all over the world. I realize that the kind of these institutions prepare yourself at such a different level, which no other private sector will prepare. You see a person working in a nursing home or a small hospital and people working here, and then you go to any national or international institution, and then you stand there, the level at which you will find is far, far superior and better than what you do.
Absolutely.
And I can assure you, I have experienced it across the world.
So
It's
basically,
not only here in another hospital, but every hospital I've been, one of the best institutes in the world I've worked. So I personally feel the kind of person this hospital prepares, it's opportunity, you have to use it. Now if you say I will come here at 9 o'clock, I'll see 10 patients, I will have food and I don't do anything. If that is your approach, then you will never grow in anywhere in the world. But this institution gives you chance.
so basically, it's the institute which makes you and defines you.
And it gives you chance. You have to build that opportunity.
And as far as money is concerned, what matters is the inner satisfaction.
And see, most of us earn enough money. Tell me, at the end of the day, what have you done? What a private practitioner has not done, which I have not done? Tell me that. And even Lopa madam, tell me. Lopa madam has also gone from Antarctica to Tokyo and New Zealand to Vancouver. And from Russia to South Africa. Don't you think, madam, you have moved around? Yeah, and I have also done that. And we have gone as a full time. It's not that we had a great one. But if you think that is your criteria, we have done all that. Maybe what we don't have is probably an sea-facing house or a Mercedes. But that is the only thing people ultimately see what happens. What do you have? I have a Rolex watch. I have a Mercedes. That doesn't make me happy. It doesn't make me happy. So what I make happy, I have done that. So that's the way of looking at life. So ultimately, what is life? You decide your own parameters. You achieve those parameters. So ultimately, it comes to joy and satisfaction.
So you define and decide what you want for yourself.
So ultimately, life is like that. And these are the things which ultimately matter to you in life. That doesn't mean, and see, today you earn something. After that, what is the value of that money? Tell me that. And you know the concept of unspent money, inherent tax. Are you aware of all this in America? Same thing is going to come to our country. You know, in fact.
But if you say this to somebody young, somebody who is in his early 30s, he says, sir, you have achieved everything. We are at the beginning of our career, and for us, at this particular moment, it is the name, fame and money which matters more. You are saying this because you are at fag end of your career.
I'm not saying that. I agree with you fully, but then from beginning we have lived like that. And we had a fame at very early age. We had what was probably, and see the whole question, the concept here is, I must tell you, is you start looking at a work-life balance. You start balancing your wealth and health. You start balancing your arts and academics. You start balancing your spirituality versus travel and your inputs. So you balance yourself. What is wrong about balancing? I'm not saying don't achieve. Achieve. You have to have achieved. If you don't achieve, you will feel frustrated.
Right.
But you also have to balance it. That if you are able to do it, then you are able to do it well.
Sir, what is your wish for your alma mater, GS Medical College? Something which you always wanted to happen but could not happen, and you want it to happen in near future. What is it?
I want the transformation in terms of technology, embracing technology while staying human. That is the word I would like to use. This institution should transform itself. It should be technologically super institutions. At the same time, you should embrace that technology by staying human. That means the humanness, the humanity, humility of this institution should remain as it is while we adopt the newer technology. We personally feel the institution upgrade yourself by keeping the values of so many years. When you're reaching to the 100 years, I personally feel we should reach to that particular point.
Do you want it to attain a deemed status like AIMS?
I tried that time. I have tried enough for these universities from Dr. Manisha Maiskar's time, Mrs. We were tried for almost 5 years, then realized that it will be difficult to run in our own system. We did not really allow it to go. But if you have an autonomous status with that kind of autonomy, why not? We will grow.
Do you think it will help to grow further and faster?
Yes.
So we should work for it. administrators and the future administrators?
Yes, you can do it. You can become a future administrator.
So, sir, if one fine morning God was to grant you a wish and said that Dr. Supe, you go back in your time, now you are 12th standard student, you have passed your NEET, how do you would want to take your career ahead? Would you still want to become a surgeon, or you would think it, no, I want to do radiology, it's more lucrative, or dermatology?
I would be a surgeon. Nothing like surgery. Nothing like putting your fingers and removing a large tumor, and nothing like clamping vessels and removing that tumor and suture and getting relief to the patient. And I think that's a surgery is most complex. It has all the skills like cognitive, technical, and attitude, and it's a sense of doing something in a very effective way. Though many people say that surgeons think less, but I personally feel surgeon is the one who has to think maximum because he can make a change, and he can. It's like uh, he's the one who can act. It's like a space shuttle. If the space shuttle doesn't go well, people will all die inside. And so I personally feel surgeon is a very person, if he doesn't do well, the patient doesn't survive. So we have to be more careful.
So truly spoken like a surgeon. Once a surgeon, always a surgeon. And the rush of adrenaline you get while you remove the tumor or whatever, it cannot be matched by anything else.
Definitely. I don't think. I personally feel we should, I would live like a surgeon. And there's nothing wrong about living like a surgeon. And it's a good to see a patient walking back home and comes to you after 1 month and says, Doctor, my pain is relieved and I'm feeling better and tumor is out. More than that, sometimes you see a patient who has operated, say, 30 years ago, and they say, Doctor, you had removed my tumor and I'm still now feeling happy. And I have patients like this, which I feel the happiest thing that, yes, we could make some change in their career and life.
So, sir, one parting message you would like to give to our...
Before that, I want you to say reminiscence or some indelible impressions right from childhood, school, as undergraduate medical student, as a lecturer, one incidents, and all your hobbies, in your, so at least there will be 10 to 12 of them. So I want you to
Sure, I'll give all those reminiscences. Even I was a Montessori student, I must tell you. That was a time when we had one teacher called Kannadebai, and she was such a strong teacher that she had very strict rule. I was hardly 4 years old, but she used to say, you have to come, you have to bring only bhaji chapati, nothing else, no biscuits, no chocolates. And she, if the mathematics or goes wrong, she used to give a vertical study. Very strong teacher that time. She was first one side of the teachership I saw. We used to get a little scared about her. But she introduced discipline, and that typically values which form at that stage, that you will be on the time, you will not do something wrong. See, many times your values formed at that particular age. So they were formed. And I think that Kannade madam, I still remember. Then when I was in a municipal school, madam, for first few years. That time my parents were not able to afford school for everyone. So we used to work at that time. The teachers were so good that time in a municipal school that I remember once I was ill, my teacher came to my home to see why I was ill for 3 days. And I had some time that time, I think mumps or something like that. So teacher following your students so much, I think that makes you definitely more thing. And then of course I went to Parle Tilak school where I had one of the different approach. It's a big school, but still many teachers really loved us. I think Vinay Apte was a great actor. His mother was Gugo Apte, and she was the teacher who used to really teach us English, but also she used to take us the whole philosophy of life. The way they used to really teach. They taught us not only life, but they also taught us the competition and how to face competition, how to survive competition, and how to think little more. My school was one school where we were taught to read editorials. They never told us to read news. They told us what is the relevance of that editorial. Today there is a Ukraine crisis. What is the relevance of Ukraine crisis? Is it oil related? Is it power related? That was taught to us. So you start looking at little deeper aspects of life every time you look at it. Of course, when I came to KEM, it was totally different. Your personality is not developed. You have so many gaps in your skills. Simple things, I must tell you, what I learned in these hospitals. I used to always get mesmerized when I used to listen to Dr. Bhatnagar or Dr. Kothari, and everybody used to come and give those wonderful speeches as a public speaking. And we as a student used to always feel, can I really speak for 5 minutes in the MLT and more fluently? But then I think I talked to Dr. Kothari once. And he told me very nicely, when I was a student, my English was not so good. So I developed it myself. So I asked him, how did you develop? So then he gave me, it's a hard work. He read books, he used, and the level at which he went, I think was an inspiration for me. So then we went to, then I went to public speaking classes, I read books, we joined, and then automatically you start going at a higher level. So sometimes, these simple things teacher inspire in you. It makes a change to you. And once you start speaking well, you start giving lectures well, then you get our invitations. And here, I personally feel half the people still struggle with these basic skills. And then you go as a surgeon, when you go, I'm sure Dr. Bapat, I must tell you, I can talk about Dr. Bapat so much. I think Dr. Bapat was one person, Dr. Samsi and Dr. Bapat, they used to look for not only your own surgical skills. I'm sure they have held my hand and made me take stitches. They have taught me how to take a stitch, how to do surgery, how to plan a surgery. They used to sit with us. That was one aspect about it. And they used to always, even if the patient goes wrong, they would definitely sit with us and console us. They tell us, okay, next time you would like to do something. Sometimes these are all incidences which teach you. But Dr. Bapat also went beyond and taught us life. As I said, photography. I always give this example. I was going to Simla and Narkanda for that time snow skiing course. The doctor gave his own camera to me with a roll put in, and he says, no, you love photography, you should take pictures and come back. Now, who would do it at that age when there was no money, there were no films, no cameras? He would give his camera. But he had faith in me and he thought that this will help us to give. So small incidences like this make you realize that the teachers are so big. And then there are a lot of patients who have taught us. So many patients where even, we have lost a patient sometimes. Their relatives have come to us. I remember there was a patient of a prostate in Dr. Samsi's unit, and we lost that patient. But his son was so good. He said, doctor, we realize how much of effort you've taken on your father. So after death of his father, he came and he renovated the whole residence room. So I think they teach you a lot. I think every time you start growing, you teach a lot. And when you become faculty, one other thing which I realize is that rather than teaching students regular, I used to teach students regularly. Every day I used to teach 2-3 hours because as a full-timer, you're either in OT or you're taking around. So on a round day, after about say 11 o'clock or 12 o'clock, you are free to teach students because you have residents and everyone. If you're not involved in administration, then many times you have enough day for the work. So that is the time you spend to talk with students. And I think those years of spend with students, I remember from say 1984 to almost 2003 till I became GI surgery. Look at those 20 batches of students. Today also I meet them, I feel so happy about them because I have spent time with them, I have taken them on hikes, we have discussed, we played badminton with them, we have sat in them for hours together in pathology museums, surgical museums, taught them cases in the evening. So that probably, I feel those moments of life are very important for you to grow. And then I think once you go into academics, I personally feel as you start growing, I feel you should plan it very well. And I could do that with a particular purpose. S.R. Nayak was my teacher, and he told me very clearly, Avinash, you should see that you start presenting papers and publications at the age of 35, you should be in at a city level. At the age of 45, you should be, or at around 40, you should be seen at a state level. 50, you should be seen at a national level. And 55 to 60, you should be seen at international. So I personally feel this formula is very good, and I could follow it at both, whether it was medical education versus surgical surgery. I think we could go to the international level in 55 to 60, and we could influence many of the national and international levels and all that. And that was only because this pathway was clear in front of me. In fact, I remember sometime in 96, I think Dr. Bapat once called me, and I think he talked to me very seriously. What are you doing, Avinash? Why are you spending time for a medical education? Why are you not spending time on surgery? So I told him, sir, I will balance my both careers, and I could do that. So I think this making you aware of all these things and then taking a controlled decision is very important for life. And sometimes you may say some of the decisions worked for me, some of the decisions did not work for me. Some of the times I failed. I understand that way. Some of the things I could not succeed. That's the way life is. If everything what you decide you get, that is not what but whatever you got, you try to make positive about it. I think many of the failures we have in our own careers where we could not achieve what we wanted to achieve. But then accept them with grace, start working for a new ventures. I think that's the way life is. And when you look back, I think you have lot of gains, you have some losses, you have some failures. I think it's okay. Ultimately, when you look back, everything is not going to be all good. There are going to be some failures are going to be also with you. But ultimately, when you sum it up, and if you feel you're on a positive side, you feel happy and satisfied.
One more. As I understand, you have good friend circle. You have varied friend circle. So, what is the impact of friends?
One of the things which education taught me, madam, is to develop a good networking. I was a typical surgeon. I must tell you, before I was a surgeon. Before 93, I was a surgeon. That means when somebody is to present a paper, I used to go and first ask what is wrong in this paper. And I would pull him down. Basically, I would pull him down. But 2 or 3 things helped us, basically. One thing, we came out from low middle class families, and we worked in the small government colonies where there are a lot of friends and parents don't have that much of time to look at you. So you live with friends. But afterwards, I realized education taught me that how to build networks, how to develop friends and maintain those relationships. So 2 things are always there. You can make friends, you can connect with people, you understand each other's what is called as a cross-cultural sensitivity, and you understand and start respecting everyone. At the same time, you maintain those relationships for lifelong. And I think today also I find that even if I have come in contact with people for 1 year, and I have done courses with them or something like that, these are our lifelong friends. Even I remember my Kailash Mansarovar Yatra, when we went for 1 month, those 25 people are still in contact with me after 26 years. And they are like family. I think photography, mountaineering, trekking, and your courses, you work differently at different levels of the world. Today, I'm very proud to say that you go in so many countries, and I can find a home there. So that is important, because I think there's a home for me from Chile to New Zealand, from Tokyo to Canada. And these are not my law students. These are all my networks. And these are all friendships which have been built for years. And these are maintained for years. Maybe there's a small message or small talk or some connections which you do. But I think that is something which I feel that gives you more joy. You can do so many collaborative work. So many papers I have written along with people around the world. And I think that is greater satisfaction for you.
So that is what keeps you sort of connected with all these people.
That is the friendships, that we kind of give and take each other. It's ultimately give and take business, and the happiness you get when you connect somebody who is from, say, I mean, you go in different language, even if it's that you meet somebody, you feel so happy. I think you have built ourselves like that, and that is something, madam, and something like, where is you have been on trekking, you spend, say, 2 or 3 weeks with one person on trekking, that bonding is totally different. When you go for fellowships and you're staying together, you're taking challenges together, you're learning together, those friendships remain for life, I personally feel. And those friendships don't die very easily. Say you're meeting somebody casually for a meeting, you will forget next day. But when you do a challenging work and you are growing together, those friendships will always remain. And you should be lifelong learners. And that is what I feel I did. I did many courses every 5 years. My last degree or something was only 8 or 10 years. I remember Chetan, I must have troubled him so much because I had gone to US all the time. And I used to do that time also one month or 2 weeks I used to go across. But I think Famer, I'm sure I used to put everything to Famer those 10 days. But I personally feel unless you evolve yourselves and engage into all these activities, your networks will not be built. And today, even Famer network is such a huge network now. Now, all over the world, Famer network, IHPBA network, ISG networks, all these are huge networks today, NMC network. Now, I think once you start bonding this relationship, man, that gives you more fun and happiness rather than anything else.
I always noticed you are very disciplined. You are very prompt in your response and you maintain your time. So, how is this discipline you have cultivated? It was built in.
From all of you, madam, you, then Bapat sir, Dhanuka madam, they have been so prompt, and I think I remember when I did Platinum Jubilee with you. I remember madam was so particular about maintaining accounts, maintaining. Madam is Pakka ISTJ, and she is the one which influenced me tremendously to do everything on time, perfectly, planning. So I think maybe initially you are a little loose, but when you start working with teachers who want all this, you start developing all this. And as you know, I was houseman of Dr. Bapat. Dr. Bapat outside may do anything. He may make fun of you, he will talk. But in the 9 o'clock when he comes in the ward, he's a very different person. And at 9 o'clock sharp, he will be in the ward. 8:30, he'll be in OT. So I personally feel these habits get formed because of the people working around you. And then you imbibe and you try to give it to everybody. And once, I think you have changed with the time. I think we were the one when there was no ultrasound, no CT, no mobile, no computers. So fortunately for us, we were the first one to do all this. We learned computers in 1985 when nobody has used to work on computers. We got our first computer much earlier in 89 and all we got our computers. We were the one who went into the laparoscopy for the first. We were the one who went into HPV. So you are always advanced learner, so you're more comfortable. I had to give up something. Sometimes endoscopic we gave away because we could not manage everything. But we gave it to the gastroenterologist, so it's okay. I mean, so that is fine. So, but what are some of these traits you develop, I think, from your teachers, something like that. I remember whenever there used to be a function, Dr. Dhanuka used to phone me at around 6 o'clock in the morning, saying that, Avinash, this is what we have to do. These are the steps we have to do. Today we have to follow this. Fine. Then it works everything on clock. So I personally feel that is a matter of the way you would build. And if you are not able to manage your time and priorities, according to me, I think priorities also, we have to make your priorities very clear, what I want. And if I want this, I have to be able to achieve it.
Secondly, I have noticed that you're interacting, whether it is a class 4 person or anybody at all, your interaction with them is one-to-one. And there the class distinction does not come in the way. So was that also cultivated or you are born with?
No, it was cultivated, madam. I think if you really see, there are some of the stories which make an impact on you, what is called as an equality. We are not talking about superiority or inferiority. We are talking about equality. I can assure you, I can talk with the commissioners also with the same kind of an personal touch in chief ministers and everything. And I can talk with mama or class 4 workers of PM with the same in affection and love. Because I personally feel you have to go to his level, or you don't have to get bogged by somebody's level. Because we are not asking anything from them. That uprightness is in your mind. If I'm not asking anything from anybody, my personal gain is not there. I'm asking from an institution, I'm going to work for myself, then I can do all this. If I start looking for my pride and my ego, and if I start looking for my benefits, then you can't do all this. So once you decide that these are the things I'm going to keep it away, then you can achieve all this upward. And then you have to just face yourself. And I think that was the reason why I could work very well with unions, every staff members, and people helped me like anything when I was a dean, because every clerk or they felt connected with me.
Yeah.
And I think that feeling you have to get from people that, okay, I'm connected with him. And it's many times, it's not a way you throw yourself, but the way you connect with each other. Connections are more important than, and see, I may have acted as a dean, that everybody should stand, everybody should remain quiet and all that. It gives me benefit for 2 minutes. But now if I enter medical college or institution, the kind of affection you get from people, I think that is more important, and I don't think work gets suffered anyway. When it used to be work, I was equally strict, madam. But beyond work, you are always there. So that we have to agree. If you're working, you have to be very strict. Beyond work, connect with people. Ultimately, they're also human beings. They're also looking for connection. They may have their own ways of looking at it. And if somebody is doing wrong, I would have put a hand on his shoulder and have told him this is not right. It works. So, madam, I personally feel that approach is better rather than the military approach.
No, that approach is better. So you cultivated it by observation or you sort of...
I cultivated through my teachers, observation. And of course, I mean, ultimately you all teachers only told me all this. So one of the things that influenced me were, again, as I told you, my teachers told me all this. Bapat sir, Samsi sir, even Kotari sir. They are the people who told me how to really build all this. And I think that worked very well with me. I think I enjoyed it, and I still enjoy doing all that. And even I now left Hinduja Khar, I have a connection from the highest patients, from, you say it, big people in the society, film wood, from there to the health worker in my institution. Everybody had loved me. So I personally, and my hospital grew very well. In last 3 years, it completely changed and became positive. So you can achieve success by maintaining good relationships. It's not that you have to really be very strict to achieve, and you can be strict at the same time remain you. I think that's the trick I always feel we should try to do. And you have your values straight, you are upright, honest and all. If you have no intentions of your own personal thing, I think people respect, thoroughly respect. So now it has become part of my trick. Now I don't have to cultivate.
So, sir, one last parting message for the listeners. What would you like to see?
I would like to see happy people, well-balanced people who manage their work life. That means a person achieves academically, they are financially stable, they have stable in their family life, they also have a good work-life balance, they have 1 or 2 good hobbies you have. And if you are able to create such people, automatically the patient service and this will improve in the hospital. So we need to change the culture of our organization to produce consultants, stable consultants who are achievers at the same time. If you do that, I'm sure the institution will prolifer. It will become much bigger than what it is. I'm sure we have little constraint of resources, that the kind of hospital we run, the kind of resources we have are much less than if you compare it with AIMS or PGI. But within that framework, we are doing fairly well. I'm sure there's a scope for improvement at every stage. And I think probably people over a time realize the value of these organizations, how much they make, especially during Corona time, people realize the value of public institutions. We should not allow to die these institutions. We should maintain these institutions, and because these are the things which would remain and grow people. If you allow these institutions to die, then we'll be selling ourselves to a commercialized market, which will be very difficult at a time of disasters and kind of epidemics. So we should maintain these organizations accordingly, because these are the consultant producing institutions. They are growing institutions. They are making people grow. So unless you do that, I think we should not do it.
Thank you, Supe sir, for
Sure.
such
Thank
a
you so
wonderful
much.
talk. We had a nice time with you. And what came out from this talk is that sir is a true clinician who dreams that this institute grows technologically into a deemed institute in near future, who has a great vision for this institute and believes in holistic approach and holistic growth of a medical student. Thank you once again. This was under the auspices of Dr. Manukotari, Chair and Division of Medical Humanities. Thank you.
Sure. Thank you. Thank you so much.